Picture this, a highly contagious virus lurking in the shadows, ready to ignite a nationwide outbreak, just as thousands of sports fans converge for an epic showdown. That's the chilling scenario experts are warning about with measles, potentially spreading like wildfire after this weekend's AFL Grand Final. But here's where it gets controversial. Could misinformation and complacency really be fueling this resurgence? Or is there more to the story? Let's dive in and unpack the details, making sure even newcomers to public health topics can follow along easily. Right now, Queensland is grappling with approximately 20 active measles cases, with the most significant cluster concentrated in the Cairns region, up in the state's far north. Smaller groups of cases are popping up in central Queensland and on the Gold Coast. And just this Thursday, a single confirmed case was reported in Brisbane. For context, measles is a viral infection that spreads through the air when an infected person coughs or sneezes, and it's notorious for its ability to linger in the environment, infecting others who enter the same space hours later. This isn't just a mild rash. It's a serious illness that can lead to complications like pneumonia or even swelling of the brain, affecting enough people to strain healthcare systems. The concern ramps up with the AFL Grand Final on Saturday, where up to 30,000 fans of the Brisbane Lions are expected to travel from Queensland to Melbourne to cheer against Geelong. Epidemiologists are sounding the alarm because measles is incredibly contagious, and with a massive crowd of around 100,000 people packed into the MCG, the potential for transmission is huge. Paul Griffin, the director of Infectious Diseases at Brisbane's Mater Hospital and a die-hard Lions supporter himself, he was once their top ticket holder, will be in the stands witnessing it all. Even brief contact, or simply being in the same room as someone who was infectious with measles up to 2 hours earlier, can be enough to catch it, Griffin explains. While he acknowledges it's unlikely someone actively sick with measles would show up, he points out that for every diagnosed case, there are probably 16 to 20 undetected ones circulating quietly. And this is the part most people miss. Measles was officially eradicated from Australia back in 2014, meaning no ongoing transmission within the country. But it's made a troubling comeback as vaccination rates have dipped. So far in 2025, more than 120 cases have been recorded nationwide, marking our largest outbreak since 2019 and potentially setting the stage for even more records if trends continue. Griffin calls this resurgence a terrible tragedy, underscoring how preventable it is with proper immunization. Vaccination rates against measles in Queensland have fallen to just 90.35%, which is below the crucial 95% threshold needed for herd immunity. That's the point where enough people are protected to shield the community, including those who can't be vaccinated, like infants or immunocompromised individuals. Griffin attributes this drop to a mix of misinformation about vaccines that surged during the COVID-19 pandemic and a growing complacency about measles dangers, as if it's just a harmless childhood ailment. But here's the controversial twist. While misinformation from social media or unverified sources has undoubtedly played a role, some argue that factors like access to healthcare, socioeconomic barriers, or even broader distrust in institutions post-pandemic might be equally to blame. Is it fair to pin it all on misinformation, or are we overlooking systemic issues? This debate sparks strong opinions. What do you think? Griffin emphasizes that measles is far from benign, with severe outcomes like pneumonia and brain swelling impacting a notable portion of those infected, posing a significant public health challenge. Drawing from the U.S., where case numbers are rising, we're seeing a return of deaths and serious neurological problems, a grim reminder of what could unfold here if we don't act. That's really something that shouldn't be happening, and we want to ensure it doesn't happen in Australia either, he warns. In wrapping this up, it's clear that vigilance is key to preventing a full-blown crisis. But let's get you thinking. Do you believe misinformation is the primary driver behind declining vaccination rates? Or could there be other forces at play? Have you or someone you know hesitated on vaccines due to doubts? Share your perspectives in the comments. Agreement, disagreement, or fresh insights are all welcome. Let's keep the conversation going to protect our communities.